How many of you are at home right now rubbing your knees, being like, oh my gosh, I would move so much more if
Did you hear
this
it pop?
knee.
Did you hear mine pop?
Yes, every time you move or do a squat, you promise if you could just feel better, you would move more. Well, Dr. Connie Carver from Wellness by Design has got some amazing things they are doing. And y'all, this does not require surgery. So if you've had knee replacement or hip replacement, you're like, wish I would have known about this sooner.
I know, right?
This is going to help a lot of people, Dr. Connie. First of all, Happy New Year. Glad to have you here in 2019.
Yes.
Yay. But let's talk about, because knee pain, I mean, if it hurts, it stops you from doing so much.
Oh yeah, I mean, think about stairs,
Yes.
climbing, activities like skiing and so forth. You got to have good knees to do those.
Yes.
And unfortunately, people think that there's really only a couple of options. They think there's either surgery or drugs. And either one carries baggage.
Right.
So with surgery, you're going to have that big scar, pain. The rehab time is about 8 to 12 weeks.
Yeah.
So it's 8 to 12 weeks where you're not able to work.
And you might be taking opioids.
That's right.
That
But
some
even after
doctor
surgery,
prescribed.
your knee can never bend as well again.
I'm
Ever
just
again.
thinking about it.
Yeah. And then, of course, the drugs. The opiates can be addictive. Drugs like Celebrex or Advil could cause strokes, kidney problems.
Yeah.
So there's not a perfect solution for arthritic pain.
And when you're on those type of drugs, you can't do anything either. You know what I mean?
I know, there's
It's-
there's side effects.
Yeah.
So we're now at our clinic using stem cell injections. So stem cells derive from what's called perinatal tissue, healthy babies born to healthy moms via C-section. We can harvest either amniotic fluid or cord blood or the actual umbilical cord. Those are all rich in stem cells and other growth factors that activate stem cells. So we combine the stem cell from the perinatal tissue along with ozone, and we inject both of those into any joint. Knees are most common because it seems to be the most
First thing to go.
Yeah, it seems to be the first thing to go, but we can do hips and shoulders and so forth, and the results are spectacular.
Wow.
Well,
So-
there's a seminar. Tell me when.
Yes, so it's next Wednesday. We usually do them on Tuesday, but this is the exception.
Okay.
So it's a week from tonight at 6 o'clock, and people are going to need, of course, to call or email us to reserve a spot. So I'll be explaining things and kind of going over, answering any questions. So yeah, we encourage people, if they can't wait till then, we have a patient liaison that can answer questions as well.
Talk to you.
Who makes a good candidate for this?
You know what? Anybody that's been diagnosed with arthritis or even a partial tear. So if
Like an
a person-
ACL or MCL tear?
well,
or?
a meniscus. I'm thinking more of a meniscus. Possibly the ACL, but more of a meniscus or arthritis. If it's a complete tear, we're probably going to say no. We don't know. We can't make any kind of
Right, that has to
promises.
be kind of.
Do you ever do hips?
Oh yes, did one just 2 weeks ago.
Wow.
Okay, so
Yes.
you do hips.
Look at the screen, Dr. Connie. We're looking at a before and after. Kind of explain.
Yeah, so that's
this
a
case.
knee, and unfortunately it's turned crosswise. But
Yeah.
the one on the left is before I started working on her, a woman about my age, but had developed some arthritis. So the joint space is narrowed and it looks a little muddy or fuzzy.
Yeah.
And then if you look on the right, the joint spaces are crisp, they're clean.
Yeah.
The cartilage has actually regrown. So this illustrates that the body has this amazing ability to regenerate and restore with the addition of the stem cell and the ozone.
Is that bone on the left? It looks like at the bottom.
It was getting
of
that way on the one side.
Yeah.
Yes, it was getting that way.
God, that would hurt so bad.
And again, she's thrilled because she didn't have to have surgery, and
Yeah.
she's on no medicines, and she can hike. She's quite an avid hiker.
Yeah.
And she can now pursue any activity she wants with no pain.
Well, because people that are active and start having these little ailments, they want to just be able to do what they were doing before. It's like fix it. I want to be doing what I was doing. I want to,
And of course, we can't make a guarantee, but we're seeing just repeated success. We just did an 85-year-old man who can now climb upstairs. He could not climb stairs. So, and again, you can resume normal activities fairly quickly within 48 hours. We don't want you to go out and run marathons.
Yeah.
But it's painless. Results are quick. There's no downtime. And even though insurance doesn't pay for it, because that's a big question I get, does insurance pay for this? Stem cells and ozone are still considered experimental. So insurance companies don't pay for anything experimental, but the out-of-pocket cost is still less then if you factor in your copay for surgery and your downtime and the physical therapy and the medications.
I mean, just that 8 weeks versus 48
yeah.
hours.
And-
I mean, right
Oh, I know.
there.
And you'll still
no
pay less
pain.
with no insurance
That's
than
right.
if you went in the
That's
hospital.
right.
Yes.
So we don't let that be a factor. You know,
Right.
come see us, and we'll give you the good news.
How many shots would you have, or injections, I guess? What would you do?
So
Would you come monthly?
typically,
Or?
so if we used to do ozone only,
Yeah.
and that one we had to do every couple of weeks. So with ozone only, I had to do them every couple of weeks, and I had a 50 to 80% chance of really getting a nice result. With the stem cell edition, I either have to do 1 or 2, and I've got more like a 95% chance of getting amazing results. So
Wow.
the gentleman I just did, his left knee was worse than his right. So the right's good to go. We may have to do another one in the left. I wait 3 months in between
Oh,
to get
kinda
the
see
maximum
where-
to see where what the body can.
You ought to
recover
bring
from.
him on the show sometime.
I know he was.
Out of town or something.
Yeah, he
like
couldn't make it last
getting
time.
ready
Okay.
for the holidays.
All right.
And I know last time you were on, I had questions that were coming in on Facebook that I didn't see until you'd already left. People, and they've actually signed up to come to this seminar,
Okay,
so
good.
they'll be here. But we've talked about knees. And back. Do you ever do like back?
I can do backs, necks.
Okay.
Yeah, I've gotten a lot of people out of neck pain,
Yeah.
shoulder pain, and of course the stem cells, not just for joints. This is what we used. We had a woman who was losing urine after childbirth.
Right.
For 20 years, every time she coughed or sneezed, there she went.
Right.
And the very next day, after we put some stem cells in the area right where the angle of the bladder is,
Yeah.
she quit losing urine after cough or sneeze. And again, no downtime, no mesh, no surgery.
Wow.
It's pretty amazing.
It is
Phenomenal.
absolutely amazing. We love that you share these stories with us because we wouldn't even. Imagine 10 years ago talking about
Yeah.
ozone and stem cells
I know.
going into.
To a meteorologist,
amazing.
ozone is something else.
I know, right?
It's not quite the
Sorry.
same. Well, let's remind everyone, January the 9th, 6 o'clock, right off Pleasantburg in Greenville, and it's best to call and
That's right.
reserve a seat, right?
That's right.
Yes.
Okay.
Thank you, Dr. Connie.
Thank you.
Very,
Happy
very
New Year.
interesting stuff. Absolutely.